Hi, this is Brian Kim. I'm going to share with you this unboxing of the SimulEYE anterior segment kit. And so I was first introduced to the SimulEYE models when I was teaching wet labs at American Academy of Ophthalmology and the American Society of Cataract Refractive Surgery wet labs. And so there's a bunch of us who teach these surgical techniques to attendees who are wanting to learn advanced surgical techniques. And so, you have some experience using animal eyes and, the corneas are cloudy and the tissues, the eyes kind of deflate and you have to kind of pin them down. It's very messy and kind of not really sanitary. And Stuart Stoll is just really a genius to bring online these model eyes, and he's kind of developed a repertoire of different types of eyes for various surgical techniques. And so I'm really thankful for his innovation, and he's really been generous in partnering with industry and also at these meetings where we can use these eyes for various techniques. So this is the kit it comes in. It's a big box. I'm going to go ahead and unbox it here. I'm holding the camera with one hand and trying to open the box with the other hand, so I apologize for looking a little cumbersome. So these are the package contents. There's capsulorhexis film kit. There's one package of a small pupil eye, one package of an aphakia eye, a 2-pack of intrascleral haptic fixation eye, and a 2-pack for anti-vitrectomy, a base plate, and a 2-pack of surface coating gel, and a 2-pack of viscoelastic. And in this case, I also have the base that you can mount the eye onto, and you'll be able to see that in the unboxing. So I'm removing all the packaging here, and this is the eye here for the iris suture and iris fixation. This is the eye for the anti-vitrectomy. Again, that's a 2-pack. This is the SimulEYE one in the little film that it comes with, so you can repeat doing the rhexis. This is a small pupil eye. Again, that's a single eye there. This is a single aphakia eye. And then these are the viscoelastics. There's a 2-pack of viscoelastic, and there's a 2-pack for the corneal coating, surface coating solution. And then there's this, I don't know if that's a memento or a paperweight, but that's also a little nice touch there. And then on the very bottom of the box, as I'm rummaging through the papers, that's the plate. That's a plate that's used to mount the eye. It's actually quite helpful because the eyes have suction cups on them. So you can see this is my setup, my microscope, my surgical chair. You can see I taped the plate onto the head of my surgical bed, and I have the eye ready to go for my very first case. So I'm going to show each of the different eyeballs and the different uses, and I'll go through individually, step by step, with each ingredient and show you various tips and tricks using the SimulEYE model in order to hopefully advance your surgical techniques. So I hope this was helpful to you, and I thank you for your attention.